All right, welcome back. I'm here with Deanna again to continue this exploration of block therapy. And Deanna, people come to block therapy for a very wide range of reasons. Primarily, I would say for physical, relief from physical pain and challenges, whether that's joint pain, back pain, scoliosis, tension, injury recovery, and the list goes on. Now, in this process, people also receive help with mental and emotional clarity. So the question is, how can one simple practice benefit so many different, seemingly unrelated things?
Well, that's such an awesome question because the fascia is the connector of every single cell in the body. So whether it's bone, nerve fiber, blood vessel, muscle, tendon, whatever it is, it's innervated by fascia. And every single cell is interconnected through this phenomenal system. It creates stability for the body, mobility for the body, and it's the communication system between every single cell in the body. So when we can actually look at the body as a whole, as opposed to all of the different parts, we see this beautiful interconnection, and then how every single thing in our world is really a function of how healthy or unhealthy our fascia is, and how we use our breath to feed our body, to release toxins. So understanding whether it's an emotional issue, a physical pain that's acute or chronic, or if you have stagnancy causing disease, it's all coming down to proper flow in the body, which is really the basis of understanding what this process is all about.
Yeah. And how does that flow get impeded? Like, what happens to people over time that causes imbalance or restrictions to form in the fascia?
So there's a couple of things, and I would say that the most obvious thing is the force of gravity. Basically, we all understand that we're going to age and get older, and what typically happens is as we do get older, we become shorter and wider. So gravity is this pressure that's constantly pulling us down. We don't really recognize it until we start to see the physical changes in our body. So another component to this is the fact that we're dominant on one side of our body. So we end up overusing one side more. So as I mentioned in the last discussion, fascia is here to create both stability and mobility in the body to protect us. So I think 70% of the population are right-handed. So for me included, so how many times would I use that side of my body instead of the left side? I was a provincial volleyball player. The number of times it rotated from one direction to another and didn't create symmetry as a result of that. So as we start to tip off balance, the fascia is like, well, wait a sec. I've got to create grips to stop us from tipping over. So as we start falling away, the fascia will spiral and grip to anything in its path all the way to bone to create that stability. Those are the adhesions that get created over time. Now, the challenge is if we don't correct that and bring balance back to the body, those adhesions block blood and oxygen flow to cells. The body becomes denser, gravity starts manipulating it further, and it goes on a continuous basis. So those grips, by blocking flow, they're basically not creating proper oxygenation in the cells. And of course, the cell first and foremost requires oxygen to thrive. It's also not allowing the waste, the byproducts of functioning, to be properly taken away from that area. So the tissue becomes stagnant and acidic and can attract other invaders to come in and take over, which we don't want. So understanding how to release those adhesions and bring the body back into balance is the basis of this practice.
Yeah. And does it matter how people develop their compression or their adhesions or how long they've had them?
Not really. And I like using the analogy, if you had an ice cube in your freezer from yesterday or from 10 years ago, as soon as you take it out of the freezer, it begins to melt. So this process is really understanding how to melt those adhesions, because we talked about how when we're breathing diaphragmatically, we're actually creating a warmer body. And the diaphragm is like the body's furnace. So when we're breathing through the muscles of the upper chest, it's more like a space heater. And I live in a 30-story building. So if I have a space heater in my apartment that only has 2 rooms, I'm really only going to be heating 1 room. Where if you turn on the furnace of the building, the entire building is heated. So it's really important that we start to engage proper diaphragmatic breathing so that we can keep all cells in the body heated, effectively, and that's going to promote flow. I live here in Winnipeg. You're a Canadian as well. We know very well what it's like in the winter. And if you go to start your car when it's -30, you can't just go in, start it, and drive away. You got to heat it up. Where in the summertime, we can just walk into the car, start it, and drive away. So we want our body to always be ready for action, and that requires heat. And again, as we get older, we tend to slow down, but we don't have to if we really understand how to keep these cells open, receiving oxygen and flow, and keeping clean as well.
And so, of course, that's what block therapy does. So is the process of decompressing and releasing those adhesions the same for everyone?
It is. It really is. And it's one of the things too, it's also about understanding cause sites versus pain sites. So that's probably the biggest challenge for people, because, for example, if you have low back pain, and there's a number of things that can happen in a low back to create pain, but if you have pain and you go and you seek assistance, likely you're going to get a back treatment. What we really need to understand with the fascia is what's causing the pain. So there's cause sites and pain and issue sites. So that's really the biggest thing. And when you start melting adhesions, whether you had a physical injury 20 years ago or a traumatic event 40 years ago, all of those are going to be adding up in your fascia. But once we start heating, melting, and realigning, it doesn't matter when or how it started. It's all about pulling those cells back to proper alignment so they can receive the proper nutrients and stay fed and clean. And then you can manage and reverse the majority of all things wrong in the body.
That's incredible. Awesome. So thank you for that. I can't wait till we get to the next question later on.
Thanks, Justin.